I'm Dr. Michael Reinhorn, a hernia specialist at Boston Hernia. I'm going to talk to you about what to expect on the first night after umbilical or ventral hernia repair at our practice. You're finally home. The ride home may have been bumpy. You might have actually been okay, depending on the procedure you had done. Most of our patients who have open surgery, whether it's with preperitoneal mesh or without mesh, have so much local anesthetic at the site of the incision that there's very little pain when you first get home. Our laparoscopic patients might have a little bit more pain because there's a larger piece of mesh placed that's anchored in place, and that can cause some irritation of the muscle fibers. So if you've had laparoscopic surgery, you might have a prescription for pain medications. If you've had open surgery, we rarely prescribe a pain medication ahead of time. That first day is all about taking care of yourself and taking it easy. Walking around the house is encouraged. Having a light meal that first day after surgery is also helpful rather than going out to eat or having a large meal. While we want you to take it easy, if you recline on a couch all night and don't get up, it's going to be really uncomfortable to move as that local anesthetic wears off. Try to move around, not sit down for periods of time that are too long. Probably the most important thing is, if you haven't already done so, have a schedule for your pain medication. So you will have gone home and have been administered Tylenol and typically an IV version of Motrin at the hospital if it's okay for you to take it. And some people can remember the time that they took it. Some people just write it down on a piece of paper and come up with a system of maybe 3-6 that they're taking Tylenol and Motrin around the clock those first 2 days. When I first was finished training, it was recommended to take as much as 4 to 5 grams of Tylenol, and that element of safety hasn't really changed, but the recommendation has decreased to 3 in general when you're having it over the counter. Since you've had surgery, it's perfectly safe to have 4 grams of Tylenol a day. Just space it out every 6 hours. We've done a few research studies, and there's really no difference whether you take Tylenol and then 3 hours later Motrin, and Tylenol 3 hours later, and then Motrin again 3 hours later, or if you take them together every 6 hours around the clock. So whatever's going to make you feel more comfortable, go ahead and do. We just find that it's easiest to take them together every 6 hours. Some studies have shown that taking those 2 medications together is just as beneficial as taking an opioid. Really important to take it before you go to bed. If your pain level is fairly strong going to sleep, then I would recommend sending an alarm for 6 hours and go ahead and waking yourself up and taking that pain medication in the middle of the night. If your pain is tolerable when you go to sleep, then go ahead and just wake up and resume the Tylenol in the morning. If you are in a lot of pain before going to bed and you've been advised that you have a prescription, it's okay to go ahead and take that prescription pain medication as prescribed. Rarely we have people who have gone to sleep, woke up in the morning, and just have been really tossing and turning or so uncomfortable despite Tylenol and Motrin that we call a prescription in the next day. Ice is also a wonderful adjunct that can be used safely through a towel or clothing to reduce both inflammation but to reduce pain after surgery. And finally, a lot of our patients do use Arnica montana. It's a homeopathic medication that has been shown to be safe after surgery and can reduce the swelling, bruising, and post-operative pain. So we're okay with that.